If you're waiting for a kidney, you may not notice any major changes, but these new rules could be good news for younger, healthier patients and for people who are on dialysis. And Eli Porter has been there for 10 years and counting. This is Eli Porter's life. Every Monday, Wednesday, and Friday, the 28-year-old spends 3 hours hooked up to a dialysis machine, filtering waste from his blood.
It is a way of life. It's tiresome some days.
Porter has been on the United Network for Organ Sharing's kidney waiting list for 2 years now, on dialysis for 10. But under new matching rules effective this week, he could move way up that wait list.
I can get a kidney anytime, any day now. So
under the old system, Emory kidney transplant surgeon Dr. Nicole Turgeon says the main deciding factor was how long you'd been waitlisted. Dialysis didn't really count.
One of the major differences is that now you will be given credit for your dialysis time in addition to your waiting time. So that will be added on to the time you've been on the waiting list.
So if you started dialysis before you were listed, your wait time will be adjusted to the day you began dialysis, which means that Eli will get credit not for 2 years, but 10.
It is big news for them. It's really going to help them in terms of getting better access to the transplants and getting a transplant sooner.
Under the new kidney allocation rules, every candidate will be assigned an individual score based on how long they're likely to need the kidney after their transplant. The top functioning 20% of kidneys will go to those likely to live the longest. Dr. Turgeon says hard-to-match patients will also get priority over the small pool of kidneys that their bodies are less likely to reject.
I think the important point is that all candidates are going to maintain their access to transplantation. We are just going to help enhance some of the difficulties that we've had in the past in terms of patients who are hard to match, who really didn't get access, are now going to get access. And patients who were on dialysis for long periods of time are going to get credit for that now.
Both adults and children on dialysis will be able to have their waiting time adjusted to their dialysis start date effective today. And I mentioned the post-transplant scoring system. That also starts today. You'll be scored based on 4 factors: your age, time on dialysis, your diabetes status, and whether or not you've had a previous organ transplant. And the lower the score you're assigned, the higher you could go up on the kidney matching list. And if you have any questions, talk to your transplant coordinator. For the Fox Medical Team, I'm Beth Galvin.